नाही नाही हां स्टेटस
ज्यांचा फोन येईल त्यांचा नंबर सेव्ह करून स्टेटस
काय बोलू
मी सांगतो. Hello, Dr. Piyush sir.
Ashish
Dr. Piyush sir, can you hear me?
Ashish Paul.
Yes, sir. We are live as well. So
Yes,
can
yes.
we start?
Can we start? Can we?
Right. So good afternoon, all of you. Welcome to another session on IndianVedyas.com, and we are very much thankful to Dr. Bhairav Kulkarni, Chairman Sir of Shiva Trust, and our very esteemed speaker straight away from US, Dr. Ashish Paul. She is a very renowned and learned professional as far as Ayurveda is concerned, and we are lucky to have her on our platform first time. So thank you so much, Dr. Ashish Paul, Dr. Bhairav Kulkarni, and Chairman Sir of Shiva Trust. By the way, Dr. Bhairav Kulkarni is one of the youngest principal in any Ayurveda college in India. So congratulations to you, Dr. Bhairav, and Dr. Ashish Paul also at a, I will say at a very young age, she has achieved several aspects in terms of Ayurveda, and today we will learn about from her that how we can take it forward. And fertility is a very crucial topic. So without wasting much time, I would like to hand over the session to Dr. Bhairav Kulkarni. And we all are eager to learn from you, Dr. Ashish Paul, today about how Ayurveda can help in several fertility aspects. And right now, I can see more than 100 people are watching us live, and we have just started. We will be seeding this event into various groups on Facebook. We are live right now on Facebook, YouTube, Periscope, and on our website, that is indianvedyas.com/webinar. And immediately it will be seeded to various groups on various platforms. So we are thinking to get a very good participation today. And I request all of you who are watching, we will have a talk first from Dr. Ashish Paul. And after the talk, or meanwhile in the talk also, if you feel you can post your comment, you can post your queries. All your queries will be answered and will be addressed after the session, after the talk that will be delivered by Dr. Ashish. Do post your queries, do send your questions and queries in between the talk as well, and definitely we'll try to resolve all of them. So thank you so much again to all of you. Dr. Bhairav, over to you, and please you can take it forward from here. Thanks.
Thank you very much. First of all, I thank you, Indian Vaidya, Mr. Piyush Juneja sir, Dr. Piyush Juneja sir. He is my friend also. Dr. Piyush, thank you very much to available this platform. And I welcome Dr. Ashish Paul, who is from London, UK. And I'm thankful to our supporter and our president, Dr. Balasaheb Pawar sir. He is with me. And first of all, I introduce himself. Dr. Balasaheb Pawar sir is our president, and he is a president of Shiva Trust. He having more than 52 trust and 52 colleges in Aurangabad, Ahmednagar, and other districts in Maharashtra, India. So he support a lot his dream to build Ayurveda career and to promote Ayurveda in worldwide. So that's why he support all the staffs, all the students, and he want to collaborate to all abroad organization to our college. he is a very motivational person. That's why we arranged this webinar with him. He is very busy person, but he gives some time and how we develop our organization. Why he is with us. So, first of all, I hand over this platform to our trustee, our president, Dr. Balasaheb Pawar sir, and I request him to welcome Dr. Ashish Paul ma'am. I hand over Dr. Balasaheb Pawar sir and say a few words regarding this conference. Thank you. Please, sir.
Hello, everyone. Hello, Dr. Ashish Paul, ma'am. Hello. Namaskar. Dr. Juneja, sir. And all respected participants, those are participating in this webinar. Dr. Bhairav is always working for the Ayurveda in national and international platforms. He has started number of webinars throughout the year after COVID in India also as well as in international level. Nowadays, everybody knows number of systems of medicines is available in the world. Number of systems of medicine having some side effects, some contraindicative effects, but Ayurveda is a system of medicine having a great history by India and from the Prachin Gurukul Sanskriti. I am giving best wishes to this webinar from my Shiva Trust, all my groups of engineering, Ayurveda, homeopathy, nursing, pharmacy, architecture, law, and all my principals, my faculties, my staffs are present here. And best of luck for this webinar. Thank you. Our trust has decided to start small courses with international level. I am also a member of Maharashtra University of Health Sciences. Our health university is ranking second in the WHO. Yesterday there is a meeting with our authority and they have permitted to our Yashwantrao Chavan Ayurvedic Medical College to start such a small duration courses in state as well as national as well as international level. And our permission to Dr. Bhairav, Vaidya Bhairav, to do such a collaboration with different countries, different students, different faculties, different staffs, and those are interested in international level, we are welcoming them. Thank you.
Thank you. Thank you very much, sir. His speech is always bless us and always motivational for us. So, the Piyush sir, he motivate me and he give me an opportunity as a principal in this college. So I thankful to him and will do in future as good as best. So we need Indian with us in available platform for next webinar also. So thank you, Dr. Sir. Thank you, our trustee president, Dr. Balasaheb Pawar sir. And I hand over this platform to our madam, Dr. Rajshri madam.
A very good morning, good afternoon, and grand namaste to the respected chief guest, honorable dignitaries.
Piyush sir, is it proper?
Yes, just ask ma'am to unmute herself and you can be on mute. So she need to unmute herself. Yeah, please. Fine. Please start.
Yeah.
Yeah, please start.
Hey.
respected chief guest, honorable dignitaries, principal sir, and all the teachers and everyone present here. First of all, before going to start today's session, as per our ancient tradition, I would like to welcome Miss Amrapali Bansode for Dhanvantari Stavan. As you all know, he is the god of medicine. Over to you, Amrapali.
आवाज येतोय ना माझा?
माझाच आवाज मला येतो.
Shall I start?
Yeah, you can start.
नमामि धन्वन्तरि मादिदेवं सुरासुरैर्वन्दितपादपद्मं लोके जरारुग्भयमृत्युनाशं धातारवीशं विविधौषधीनां शङ्खं चक्रं जलौकां ददतमृतघटं चारुदोर्भिश्चतुर्भिः सूक्ष्मस्वच्छातिरुद्धांशुकपरिविलसनं मौलिमम्भोजनेत्रं कालाम्बुदोज्ज्वलाङ्गं कटितटविलसच्चारुपीताम्बराढ्यं वन्दे धन्वन्तरितं निखिलगगवन् प्रौढनावाग्निलीलम्
Thank you, Amrapali. Now we will like to start our session. Myself, Dr. Rajshri Shilimkar, Assistant Professor.
Please unmute the other system. There is some issue with your system in voice, so you can unmute the other system also and continue. Thank you.
Now is it clear, sir? Am I audible?
Yes, please continue.
Yeah.
Okay, thank you, sir. Myself, Dr. Rajshri Shilimkar, Assistant Professor at Shiva Trust, Yashwantrao Chavan, Ayurvedic Medical College and Hospital, Aurangabad. Aurangabad is tourism capital of Maharashtra and well known for the famous caves Ajanta, Ellora. First of all, I would like to thank my institute, Shiva Trust, Yashwantrao Chavan, Ayurvedic Medical College and Hospital, Aurangabad, respected Chairman, Honorable Dr. Balasaheb Pawar sir, respected Principal Dr. Bhairav Kulkarni sir, respected Vice Principal Dr. Pankaj Gahunge sir, Hospital in charge Dr. Sandeep Kamble sir, and my colleagues for giving me this opportunity. It is a great pleasure for me to introduce our eminent speaker for this session, Dr. Ashish Paul. She is a qualified Ayurvedic physician, Bachelor of Ayurvedic Medicine and Surgery, and a medical herbalist, MSc Herbal Medicine, and presently practicing at Harley Street, Melbourne, London, UK, also known as the Heart of London. Today, she is going to talk with us about natural fertility and its scope in the management of fertility issues. This is a subject in which we should all be deeply interested because our next generation is our future. Our speaker, although having spent most her entire career advising couples on their journey of parenthood by improving their fertility with ancient Ayurvedic medicine and Western herbal medicine. She teaches yoga and breathing techniques to all her patients. She utilizes meditation, yoga, and also her NLP hypnosis skills to achieve the desired outcome for her patients. These therapies work with the natural rhythm of the body, treat the cause of a problem, and have less adverse effect. Her aim is to bring awareness to the holistic benefits of Ayurveda and the Western herbal medicine. She passionately speaks about protecting women's health before and after having a child. She educates people about the preventing methods to reduce the risk of diseases and live an optimally healthy life. Now, with a great round of applause, I would like to invite our today's speaker, Dr. Ashish Paul, for her guidance. Welcome, ma'am, and now over to you, ma'am. Thank you, ma'am.
Wow. Okay, that was an introduction. Thank you so much. Thank you to everybody. Let me know if you can hear me clearly. And yeah, I generally like interactive sessions. I would like you to give me feedback. I would like you to ask questions. I would like you to, give a comment so that I know I'm going in the right direction and you can get me and you can understand my viewpoint. So you have already said everything about me, but yes, I practice in UK. This is all natural medicine and Ayurvedic medicine that I'm doing. And I will tell you my reasons to get into what I'm doing right now. So when I was doing Ayurvedic medicine, I did my degree from the Ayurvedic College, Jalandhar. And in the third year, I started going to gynae hospital. So I've been involved with gynae and obstetrics since then. That was long time ago. And I worked there afterwards once I qualified as well and along doing my degree. And one of my reasons, or one thing that I wanted to do had I stayed in India was to open my own gynae clinic, use modern and Ayurvedic methods together. That was the aim at that time, over 25, 26 years ago. But then I moved to UK. I had to redo a lot of things. And then I qualified in herbal medicine, which is Western herbal medicine of United Kingdom. And I did masters in that as well. So my link with gynae and obs start from way early. That was one field in which I wanted to serve. If I have an opportunity today, I'll go to India and open a gynae clinic, because here I cannot do that. I have to be an MD in gynecology, and then I will be able to do that. But I have come round circle to serving people with natural medicine, with Ayurveda. Over the last, I would say, since 2015, is specifically that I'm doing fertility medicine, natural fertility medicine. And I tell you, like a story, it is a story. I don't know if you're interested in stories. I have IVF twins, a boy and a girl. They are almost 13 in April. And when I used to take them to this, it's called Twins and Triplet Club. And I used to take them to that club when they were about a year old. And that's where I started obviously meeting other moms who had twins and triplets. And there are more chances that if you have twins and triplets, you have had IVF. That you have had IVF and that you have struggled with fertility issues for many years. And in my case, my IVF is a success story. First time IVF, first time having twins and successful pregnancy. And we all know that first time success rate of IVF is not, it's, I think, hardly under 10%, even if that. And overall success rate of IVF is about 25 to 30%. So I come in a really small category of people out of fertility issues, people who have gone to IVF and then got successfully pregnant and stayed pregnant first time. So I'm one of those. And that's where I started meeting women mainly. who have had IVF cycles, 6, 7, 8 IVF cycles. So those of you who do not perhaps fully know or may not have looked into it yet, one IVF cycle and the preparation for it, collection of eggs, and then putting back or transferring of embryos, that whole thing sometimes can take about 6 to 8 months from the time a couple prepares for it, gathers enough cash to pay for it, brings them to that point where they go for appointment and then fix all the times and then have the whole thing. Perhaps 8 to 9 months, say at least that we are looking at. So when somebody has had that many number of cycles, you can multiply the number of months we are talking about here. So some women, some couples have been on this journey for years. We're not talking about 1 or 2 months. We are talking about 2, 3, 4, 5 years and longer. Because even from the point they start IVF or any intervention of any medical intervention or even Ayurvedic intervention, they must have tried beforehand, where they stop contraception and going for natural pregnancy for 2, 3 years sometimes, and it doesn't happen. So we are really looking at long history of someone when they come to an IVF clinic, and especially if they come to a natural medicine practitioner like myself, that means they have years of trying of becoming becoming parents. So when I looked at these women, who were going through, have had successful, obviously they had children, but they have had that many number of cycles, and that they didn't mention. It just got mentioned in a conversation because it is very emotional, and people or women or couples do not like to necessarily talk about how many cycles of IVF they have gone through. So that's where I thought to myself, why are we not doing anything natural? We have Ayurvedic medicine, we have herbal medicine, and we have other modalities, other paradigms of natural therapies, medicines. Why are we not doing anything? Why are we not supporting these women before, during, after? And also, why are we not just educating people to come to natural medicine as first point of call? When they start getting pregnant, when they're wanting to get pregnant, at that point. Because many a times by the time couple comes to me, or you probably have similar experience of those of you who practice natural fertility, is that it's too late by the time somebody comes to you. Along with IVF and everything else, people spend all their resources in terms of money, in terms of time, in terms of emotions, in terms of their effort of doing something. It's very, very taxing. It's very stressful because, fertility is every, the opportunity for getting pregnant we are looking at literally 48 hours every month. Yeah, that period when a woman is ovulating and to have successful intercourse where a sperm can actually impregnate an egg is really 48 hours of that window. So if those 48 hours are missed 1 month, then you're waiting till the next, and so on. So what happens is there is chronic stress that builds up along all this time. Every month you're waiting. Am I pregnant? Am I not? Are we pregnant? Are we not? You're doing your test. You're waiting for periods to hopefully not come when you're trying to get pregnant. So that is the backdrop that we have to understand for somebody who has come to a practitioner or who has gone for IVF. This is what they have gone through month after month. In certain countries, obviously, that thing starts very early. It may be as early as 24, 25, or even earlier when people are looking, or couples are looking to get pregnant. In Western countries, it does not start as early. We are looking at 30 plus, where at least woman's age is 30 years old and plus. when they start to look into getting pregnant, when they stop contraception. So that is my, that's how I came round circle working in gynae and obs, and then looking at all these IVF women, and also looking at, I had some patients who were going through recurrent miscarriages. So what we call spontaneous abortions. And there also I used herbal medicine, I used Ayurvedic medicine, and they got pregnant. And that got me thinking as well. So that's how I have come round circle to doing what I'm doing right now, and doing since at least 2015. So this year, 6 years. And of course, Ayurveda for a long, long time. So I want us to think, what is natural fertility and why are we thinking about natural fertility? And also, what can we use? Where can we use all these methods of natural fertility? So, as I said, please, I would love to answer any questions that you have or comments as well. So please feel free to comment and question as well. So one of the things that we are looking at, natural fertility or overall fertility, why we should be looking at natural fertility, is, as Dr. Rajshri pointed out, it is about next generation. Yeah. So it is also not just about next generation, it's just otherwise next generations, and overall through pregnancy, through our kids, we are also passing the genetic material further down. So we are also looking at the quality of the genetic material that we will be passing down. How we are doing things, how we are getting pregnant, how we are keeping that pregnancy, what we are using, however many medicines we are using, then what happens to the genetic material that we carry on forward as children, and then of course as adults. So that's why it's hugely important for us to be thinking about natural fertility. And I always say this, I don't know if you have similar experience, but I am staggered to the point that IVF clinics in India do not use Ayurvedic medicine. I mean, I don't think it can get more sad than that. Here we in the West or in other countries where we don't have Ayurvedic medicine, we don't have natural other therapies, we can think, okay, they don't know about Ayurvedic medicine, that's why they are not using it. And my experiences here in the UK is that when I speak to consultants, I speak to people, they're highly interested to hear more, and they're highly interested to perhaps collaborate in some way. But India, which is the hub of Ayurvedic medicine, for us to be not using natural medicine alongside any fertility medicine, that is just beyond my understanding why we are not doing that. So anyone who is, I don't know, if you are looking to become, because I know that you can get involved, there are different other courses which you can do and work in the IVF clinic, so you can open your own IVF clinics, then think of natural medicine, make it integrated. So my view of natural fertility going forward, how it should be, is that my practice is what you can call integrated practice. So integrated or integrative medicine is when we use and utilize other paradigms of therapies, medicines, mind paradigms, body paradigms, all of them together for the benefit of the patient. So I use in my, the way I approach fertility, and I'll share my method with you as well, is that I use Ayurveda is the base of everything that I do. So there is Ayurvedic medicine, Ayurvedic herbs. I use Ayurvedic, all the therapies, Abhyanga, Panchakarma, Basti, all of them, Shirodhara. Then I use Western herbs also. Sometimes if I don't get Ayurvedic herbs here in the UK, then I use Western herbs as well, mainly in the form of tinctures. I use yoga because I'm trained in dynamic yoga. We have a specific method of yoga here called dynamic yoga. I'm trained in that, so I use that. I'm also trained in NLP, which is neuro linguistic programming, which is to do with your mind. It is about changing those pathways in your brain to think better, to feel better, to act better, to improve your mindset. So I use that, and then also hypnosis. I use all of these together in my practice. And most of my patients who I work with, they are already perhaps using acupuncture. They might be using reflexology as well. So you can see all of these are working together. So it becomes integrated medicine. Even when you don't necessarily you are not prescribing it to your patients or clients, but they might be utilizing it, or they might have utilized it from somewhere else. Yeah. So all of that together becomes integrated practice. And that is the way forward for us to be working, looking at whatever else we can utilize. So I don't particularly, that's my view, is that benefit of the patient or the health of the patient is the supreme goal for me. So it doesn't matter how I achieve that. Yeah. So I'm not only going to think that I will only use Ayurvedic medicine and nothing else. Of course, Ayurveda is the base of everything. So doshas are the base of everything. So I use everything else according to that, according to the personality, according to who they are, and according to what will be suitable for them. What kind of mind therapy will be suitable for them? What kind of mantra will be suitable for them? So I use all of that on the basis of Ayurveda, but I use other systems that I'm trained in, but you can always collaborate with people or the doctors or the practitioners who are trained in that, and you can work together as a team as well. Yeah. I mean, one of the things that I had learned, and this is not in the natural medicine, this is in the field of cancer. And I know of some really highly successful cancer clinics in the world because I had plans to work with them, is that they are using integrated systems. They are using the best of everything. So they are using herbs, they are using, if there is mind therapy, CBT, which is cognitive behavioral therapy, NLP or yoga, they're using all of that. And that's where the success rate is higher. Yeah. Okay, so that's a little bit of background for how I come to do what I'm doing now. So why we should be looking at natural fertility for women and men and for couples and overall, why do we want to use more natural therapies? Yeah. So IVF is about 40 years old. The therapy or the modality of IVF was developed in the UK and is about 40 years old, or maybe 42 years old. So that means it it has only been used for that many years. And this is now being seen as the golden standard of fertility medicine, that this is the highest. Couples or people are in the mindset, oh, yes, we have IVF. We can always do IVF, right? And as I had already mentioned before, the success rate of very, very successful clinics even is about 50%. So we are looking at 50% of the rest of the couples who will not succeed. Yeah. Also, the stats that I have seen, or the data that I have seen, is about 20%, between 20 to 25% couples where the fertility is unexplained infertility, where why somebody cannot get pregnant cannot be explained. All the tests are fine, patients are fine, healthy. There are no other reasons. They've gone through all number of tests and still they cannot get pregnant. That number is between 20 to 25% of overall infertility patients. So I think that's a huge number. Secondly, and I wrote about this in my blog as well, secondly is when we talk about those 20 to 25% of people, we are not really, it doesn't consider people who might have gone to Ayurvedic practitioners. Those numbers only consider the people who have gone to medical doctors. Yeah. So we already do not have, I don't think that's a fair data, but at the same time, we have the potential to work in that 20 to 25% of couples where we can help them, where there is nothing is being explained. Doctors cannot, or medical doctors have no other thing to offer to them, we can offer them natural medicine. So that's a huge market sector, if you think from a business perspective as well, where we can help. And also from a medicine perspective, there's huge number of couples that we can, I mean, if you have to think from out of whole infertility couples, how many millions of people we can help. So that's one thing that we need to be looking at natural medicine, because there are a huge number of people who are not being given any reason, and there is probably no reason apart from them being aligned in their body, mind, and spirit, as we know from an Ayurvedic perspective. Why else should we looking at natural fertility? One of the reasons, I think it's everywhere, may not be as much in India as it is in the West, that women are having children much later. Whether they're having them on their own, they're becoming single mothers, or they are having with a partner, or a couple is getting pregnant, that age is getting later and later, because people are getting settled first, having some good amount of background to them, and also good amount of financial background to them, and then thinking of getting pregnant. So that age is becoming later. So we need to be looking at preserving fertility for someone until 35, perhaps 35, or around 32, 33 comes to my mind, because that's where I see most of the clients. So that's, if we look from traditional point of view, Ayurveda says the fertility at its highest is between 20 and 25. And I don't think in this day and age, anybody should be looking and getting pregnant 20 to 25. It's too young. Yeah. So that's one reason, preserving, protecting fertility for women. Also, if you have looked at studies, and I don't know how the data is in India, but the data that we have in the West is that men's fertility, the sperm motility and the sperm's health is reducing drastically in the West. Yeah. And the last study that I looked, it has reduced in the last 10 years. No, more than 10 years, it has reduced 50%, and it is still reducing. So something is happening to the sperms. So we need to be looking at improving men's health, yeah, and also improving and preserving the health of sperms, and also the motility and overall health, holistic health of the men as well. So that is a reason to be looking at natural medicine. Yeah. Thirdly, we have one of the things I think which we don't probably necessarily talk, speak enough about, is the chemicals that we have in terms of pollutants around us, in our cities, even in our villages, and also pollutants that we have in our water supply, pollutants that we have on our foods, and pollutants that we have in terms of especially the plastic that we have around us. And these are called the hormone disruptors, and how much that is being leached into the blood supply and causing the issue with our hormones. So that, I think, is being ignored. We do not necessarily talk about all the things that we use in our house to clean our house. Anything that is spray based goes straight into your bloodstream through the nose. And the effect of it on your hormones can be quite deadly. So looking at that, and we know that we are using more and more and more chemicals in overall as a society. We are using more chemicals, which are really not good for hormones, for men and women equally. And then we also have the issue of contraceptives. So contraceptives for women, we are talking about the oral contraceptive. The pill that women has been taking is about 60, 70 years old, or maybe 80 years old maximum. So women have been using contraceptive for that long. Also, some studies have been done on that contraceptive, being leached into the water supply, and the effect of that when it goes into the water supply, into the grass, and the animals that are feeding on that grass. Also, that we are drinking that water supply, and how much hormones are in there because of the extensive use of contraceptive pill. So that is also affecting overall affecting hormones for the general population, and also it affects the fertility for women. Yeah. Yes, it doesn't affect in everyone, but there is a huge number where contraceptive pill affects your fertility, and the longer you have used it, the more impact it's going to have on your fertility. So all of these reasons, if you can think of any more, share with me. But these are, I think, are the main reasons why we should be looking at, why we must be looking at natural medicine and supporting women. Especially, I say women. This is not to exclude men in any way, but because most of the fertility medicines eventually will have to be taken by women, because they are the ones who will be carrying the babies. So we need to be specifically looking at women. So I think those are the few factors, according to me, because of which we need to be looking at preserving fertility and then also treating and managing fertility. So as we know, fertile years in women are from the time they start menstruating to the time of menopause. So it's not only, fertility is not only there just to produce children. It is, of course, there for that reason too. But women also have to live before having kids and after having kids healthily, with their uterus and ovaries and the whole hormonal setup that comes with that, as a human being for themselves. So we need to be protecting fertility right from the beginning and up to menopause, and overall as well, and for men also. So it is not just only women, but yes, men and women equally. And then going forward, so that we have, even if my point is this, that even if you do have to use, say, for example, you're using Clomid, or you're using IUI, you're using IVF, you can still use natural medicine alongside, of some kind, of something little, so that you don't end up with the side effects that we have of all these medicines and drugs, and also the side effects or the after effects of the whole stress of fertility, trying for years, the whole stress of all of that. Yeah. Okay, I hope this is clear. I'm making sense here to everyone. Yeah. So where can we fit natural medicine? Yeah. The scope of natural medicine, the scope of Ayurvedic medicine, where, at which junction can we use it? So I'll explain, my thinking and how I use it as well. So natural medicine, as I said, Ayurveda in India, we are blessed that Ayurveda is a complete system. When we are trained in Ayurvedic medicine, and for those of you who are trained to the level of MDs and MS and much more, even more in depth, we have information and knowledge and the wisdom of Ayurveda. It's a complete system. When you're working with Ayurvedic medicine, you do not necessarily use anything else. Yeah, you can choose to work with something else, but you do not necessarily need. If you don't want to, you can just work with Ayurveda, and that should be enough. Yeah. Okay, so where can we use natural medicine? From my and I'll keep giving you the reasons I've already given, and still explain where should we be using. First, we should be educating boys and girls, or perhaps even parents as well. Controversial, but I think we should be educating everybody in good sexual health education. Yeah, for all younger boys and girls, how do they need to look at their sex? How do they need to look at sexual health? What is sexual health? What is healthy human being? And how to look at fertility, and also to think about fertility from that point onwards. And I tell you one reason why. Because girls as young as 17, 18, I have seen, who have endometriosis or PCOS, which is a whole increasing number of girls are being diagnosed with that, who have already been on contraceptive pill for 4-5 years. So they started, if I'm seeing at 18, they started at 12 or 13 or 14. Yeah. So just imagine the impact of using that. And many a times they are told when they are 18, 19, 20 years old that they will have to be on this contraceptive pill for most of their life, unless for the time when they want to get pregnant, they can come off it, get pregnant, and go back on another pill or some kind of contraceptive pill. And to me, that is, that just sounds so harsh, using contraceptive pill for that many years, and they've already used it. That is because modern medicine does not necessarily have the tools. They're not thinking in terms of holistic health. So we need to be educating young girls about their period health. Also, what can we can use so many herbs, we can use so many therapies from Ayurveda at that time when they are younger, so that they do not get to the point of being prescribed a pill. And they can use some herbs to manage their difficult periods, if they have those, to manage their PCOS, if they have that, to manage their weight issues, if they have, or any other hormonal issues. So they do not end up with all these steroidal hormones that they might have to take. Then comes the point of, until from that point when they start periods to the point where somebody wants to get pregnant and wants to have kids. So that time could be 10 years, 15 years, 20 years in between. And especially in the West, for sexually active people, and most of them are, they have to use some kind of protective method. So to teach them certain, perhaps there are herbal contraceptives that we can use. Perhaps there are other methods that we can train them so that they don't have to use contraceptives. And that prevents and preserves their fertility for as long as we can. Yeah. Where else can we use? When anybody who is looking to get pregnant, thinking about getting pregnant in a year's time, say perhaps, or getting married and then will be starting their family straight away, should be the one to go and consult an Ayurvedic practitioner or a natural medicine practitioner and their gynecologist at the same time, to think about what else can I do naturally. So there could be a huge program at that level, like we have Garbh Sanskar. How many people take up on Garbh Sanskar program? Yeah, probably not that many. So idea is to make it much more wider. And perhaps in those places and countries, perhaps where there is, we could roll it out as a program with the government program, so that we offer that support and help and that advice from Ayurvedic point of view, from natural medicine point of view, at that point, just before they are starting to get pregnant, at least that. And I would say 1 year is a really good time to prep yourself, for both men and women, to think of their habits, to think of their diet, to think of their lifestyle, and then actively taking herbs and therapies for 6 months before they really want to get pregnant. Yeah. So 1 year time, that's where we can be fitting natural therapies and natural fertility medicine. Then at the time when somebody is going through different methods of fertility, and usual route, as many of you might know, they are given Clomid, then there is IUI. Then if nothing happens with IUI, they might be given more Clomid. If that doesn't work, they might be offered IVF. And, that itself can take, sometimes 2 to 3 years in between before they are given IVF. And then the IVF, the whole journey starts. So at any of those points, they can be using natural medicine alongside. Even if there are concerns of natural medicine or natural herbs interacting and contradicting with the modern drugs, there also we can use therapies. We have Ayurvedic therapies, we have fertility massage, we can use Abhyanga and fertility massage, we can use Shirodhara, we can use Basti, we can use those therapies, we can use Panchakarma. I think everybody who's going for pregnancy should have a Panchakarma program. So all those points. So basically at any point, we could be using natural medicine. That is my view. And of course, I am biased in my view because I practice natural medicine. And then through IVF as well. So I support couples who are going through IVF. I do give them herbs. I do give them internal supplements. They're already taking a lot of nutritional supplements as well. And then I do longer programs with them together. Yeah. Any success cases after 40 years? Yes, I have success cases after 40 years as well. Yeah. Okay, so I will just share briefly how I utilize natural fertility medicine in my clinic and how what I offer to my clients. And I think that's probably the last point, and feel free to then ask questions. So I have 6 modules in my program, and it is called Rejuvenating Your Fertility. So my thinking and my approach comes from the Rasayana, from Ayurveda. And one of the reasons I have chosen that particular aspect of rejuvenating fertility, rejuvenating eggs, rejuvenating sperms, rejuvenating their health overall, is because one of the reasons for decline of fertility is that eggs and sperms become too old. They are aging too fast, sometimes even prematurely, even in early 30s. Somebody can have, in a way, not as active sperms or eggs. The number starts to reduce, the quality starts to reduce. In sperms, the motility starts to reduce, all of that. So that's where my thinking comes from, is to rejuvenate their fertility. And also, I feel by the time somebody comes to me, they already are so knackered, tired with doing all of that they have been suggesting and going for, appointment after appointment without any success. So that is another reason to help them, support them, and not to tell them to relax, but to help them, give them tools to feel relaxed eventually. So I have 6 modules in my program that I do, and I normally do this for 3 months at least with my patients, is to work on these 6 sides of themselves. And they can do this online, offline, in person with me as well. So first is to rejuvenate their physical health. So how can we rejuvenate physicality of them as being people? So that's where the massage comes in, abhyanga comes in. That's where their physical being comes in. How can we relax them using fertility massage at that point, telling them to self-massage? Because especially here in the West, and I'm not sure even in the East, that people are using anything in terms of, sorry, I lost my thought. Anything in terms of helping themselves to relax. And it is not about telling someone to relax. You can't tell someone to relax. It doesn't happen like that. It is by doing some form of therapy where your body starts to unwind itself. Yeah, that comes in physical rejuvenation. And I teach this online as well. So you can learn this step by step, how to do that something little every day to support your fertility journey. Second step is to work on diet and nutrition. So this is diet and nutrition from modern as well as Ayurvedic perspective. And I think I'm really glad, actually, I have got 2 or 3 or more friends who are practicing functional nutritional medicine. So where they are taking into account what Ayurveda would take into account, which is not just only the nutritional quality of a food, but also your constitution, the time of the food, the portion size of the food, how do you eat, how do you cook, what oil do you use, what organic or non-organic products you are using, all of that. So I use that assessment. I take a lot of time in detailing what is suitable for their constitution, what is not suitable for their constitution, and also to put a plan for themselves how to be using healthy foods in their diet. Yeah. So that's diet and nutrition. rejuvenation and helping them. And so many people I have heard from this now, where they said that, yes, everybody who talks about, even people have heard this in terms of weight loss and some other health issues, is everybody talks about this food is really good for you, but is that food suitable for you? Yeah, so that's the point. Any fruit may be really good in itself, but is it suitable to your constitution? Is it suitable to you as a person? Do you even like that food or fruit or not? I mean, you can't eat something which you really hate to eat. So looking at all of that and doing, intense analysis and then putting in place and giving them some Ayurvedic methods, some Ayurvedic recipes, some Ayurvedic spices to use according to their constitution. So diet and nutrition. Then there is lifestyle. How does a person live their life in their daily life? From morning till the time they go to sleep, how do they get up, sleep, eat their food, eat their lunch? Where do they work? Who do they work with? How is the relationship at home, in office? How do they commute to work? All of those factors come into play because that lifestyle is creating or not creating that stress for you that you might be sitting on. It is also a factor for you to consider in terms of somebody's finances, how that might be playing a factor in their whole fertility journey. So lifestyle factors are huge. Are they exercising? Are they drinking, smoking, taking drugs, doing anything else? That comes into play. So the fourth thing is about cellular health. So as I mentioned before, that at the level of the cells, and this also comes in, there is a lot of discussion about this in anti-aging medicine or rejuvenation medicine right now, or longevity medicine as they are calling it now, is to work on the mitochondria of your cells, because mitochondria is the powerhouse, as you all probably will know, being science students. That's what drives the energy. Those are the energy centers. So those energy centers are becoming depleted, not necessarily with age, but even earlier and earlier on. And how can we support the cellular health at the level of the cells? Yeah. So something like Panchakarma would be great, because we know we are helping and working at the level of the cells. Antioxidant medicine, our herbs which we use in Rasayana, would be great to work at the level of that, those cells, to enhance their health. Cellular health is also about good breathing. So pranayam is one of the ways to improve your cellular health. To take that effect right down to your cells is only through the breath and the blood. So working with that, giving them herbs that are highly antioxidant herbs, and also giving them foods that will work on that. So that comes in cellular health. Then there is mind thing, the whole thing about manas, the mind, the mindset itself. So what is somebody's reasoning? What is your why? Why do you want to get pregnant in the first place? Secondly, what are you ready to do to change yourself, change your lifestyle, change certain things so that you can get pregnant? Also, there is huge stress factor. There may be huge psychological issues that people are not aware of, something that is blocking them from becoming pregnant. Also, in that mindset, I also work on both the couple. If there is a couple, if it is only single person, we only work on single person. But if there is a couple, then working on both partners' mindset, how their interaction is with each other, and how their mindset is affecting one another. One person may want to have the pregnancy, the other one may not want to have the pregnancy, at least maybe not at that time when the other one is thinking of. And what are their reasons? So going into that and supporting them with that. And within that, I do meditation sessions, I do NLP exercises with them, which is about giving them a flavor of how would it feel for them to have a baby that they are trying so desperately. How would it feel? So that is discussed and worked upon in that mindset psychological module. Then the last one is to work on someone's sex and intimacy issues. So, and it may be, it looks like a joke, but I have had couples where they have come for fertility consultations, and when you ask them, they are not really having sex, and they're not having sex at the right time. So I really doubt they will get pregnant. Yeah. So to work with them, to help them to have good quality intimacy. How does your quality of intimacy affects your pregnancy? Because it has a direct link with that. How is your sexual health affects your pregnancy? How does your sexual health affects the quality of your eggs and sperms? That is also discussed in that. So those are 6 modules, I think. So that's how I work in depth, working on all those aspects. And these can be worked on at any point where a patient wants to work on them. Yeah, I think, am I going over time now? Hi. Please give me feedback. Otherwise, I think I'm just wrapping up.
You can continue, ma'am. Please continue, ma'am.
Okay, I think I've said most of the things.
There are some questions. Sorry to interrupt you, ma'am. There are some questions. If you permit, we'll go for questions also.
Ask the question. Yeah.
Yeah. I welcome to Dr. Vipul, sir, for our question session. Over to you, sir.
Namaste, ma'am. Dr. Vipul here from YCMC Aurangabad, Yashwantrao, Chavan, Ayurvedic Medical College. I am working as an
Namaskar.
assistant professor in Panchakarma department. We have worked in COVID-19 also, and we have multi-story, 4-story building and 100-bed hospital, full working. We are having 52 faculties on our board, and they are having specific qualified and experienced teacher. Thanks, ma'am, for such a wonderful session. I must say, after listening your session, you are one of the pioneer Vaidya in integrated medicine. I would like to ask some questions regarding whether you can use or you have some experience with allopathy medicine and rasa aushadhi. You have used any rasa aushadhi with any specific allopathic medicines like hormones therapy and the blood anticoagulant medicines, which most of the time IVF sessions they have advised to the couples.
Yeah.
Yes.
So I have used the gold preparations with sperm issues with patients successfully. I have used that. Although we have, and I'm going on record saying this because we are not allowed to use metallic preparations or rasa aushadhi here in the West. But this is somebody whom I knew otherwise, and I recommended they bought it separately. So because I cannot prescribe a rasa aushadhi technically, but they have used it. They have a little girl, and so yes, we can use. And this is not about whether we can use or not. It is about how good you are as a practitioner to be able to use it.
Yeah. Yes. Right, ma'am. And one more question is like, is it really useful for going Panchakarma therapy before IVF session?
Yeah.
You
absolutely.
have any? Yeah.
So my work, which I am explaining, I explain my 6 modules. It is based on Panchakarma because I do 8 sessions, intense 8 sessions. I don't do full Panchakarma because it is very long. It is very time consuming. People don't have time. People who are on IVF routine, they are rushing. They're already short of time. So I do these 8 sessions where I do Abhyanga, Swadan, Basti, Shirodhara at the same time. So it's like intense session of 2 hours for 8 days.
For 8 days, like in a yoga basti manner. For any specific basti like Madhu Telik basti or Yapana basti you have?
So I mix sometimes because it depends really what the patient needs. So I may use both the bastis and alternate with them, or I may only use,
according to your opinion, IVF success rate can be gone upside if the couple are going to have Panchakarma sessions before their IVF session, right?
Absolutely. So what I normally say is, my advice would be go for Panchkarma and then go for IVF. You will have
Okay.
high success rate without a doubt. When you start IVF, then you can't interfere in between. Then you can't do Panchkarma programs. You can't do certain herbs. You cannot do very invasive or strong Ayurvedic herbs because they're already on a very long protocol. I don't know if you have seen IVF medicines. It's like my patient send me pictures of injections and injections because they have to take progesterone injection every day and so on and so forth. Yeah.
Ma'am, do you have any experience regarding the patients having low AMH value? Anti-Mullerian hormones level are in very less manner, and then you are having like you are went to the some Panchakarma therapies, and then you have evaluated themselves like they have increased AMH or not, or whether Ayurveda is really helpful or not in this kind of disorders.
So most of the patients that come to me, they have low AMH value because they are in
Okay.
that
Yeah.
category of age 37, 38, and even 40
Okay.
plus. But I have used Ayurvedic remedies. It takes longer time. It definitely takes 6 to 8 months to 1 year of giving them herbs and doing therapies, doing a lot of bastis. And I like doing bastis for fertility. With that, we have increased. With that, we have got patients pregnant as well. But it is for somebody who's very, very well committed. If you are
Yeah.
someone who's looking for a quick fix in 2, 3 months' time, it won't work.
Yes, yes. Ma'am, we have one more question. Can you throw some light on a herbal contraceptive, which earlier you have said in your session? Herbal contraceptives used in your day-to-day practice. Can you elaborate?
I don't personally, I don't use it as such personally or don't prescribe it, but I have seen it being used. And we also have some Western herbal, what is
Right.
it? It's like a jelly or vaginal solutions
Yep.
that you can use
Yes.
as contraceptives. We know that neem is one of the herbs that can be, it's a spermicidal, so it kills sperms. So that has also been produced, I think, as a jelly or as a cream that you can use before you have intercourse. So those kind of contraceptives you can use. Otherwise, it's the natural method of following your fertile
Right.
cycle. Most of the
Yes.
women don't know that. Yeah.
Yeah. Ma'am, we have one more question from Dr. Lungare. He's asking whether oligospermia, you might have seen such cases in your day-to-day practice. Only Ayurveda medicine is useful, or you will prefer integrated medicine, like some allopathic combination with Ayurveda or anything else, like some kind of a specific formulation, ready reckoner for the our participants.
I would like to use Ayurvedic herbs and therapies for them. So hydrotherapy works really well to enhance the performance as well as to enhance the sperm's quality as well. So I have used that with my patients. I've worked on few patients with erectile dysfunction and also with the low performance or low libido as well. So it works
Okay.
well with that, but the therapy work, they need to be coming for therapy, for massages, and also to tell them certain exercises to do. Like we have Kegel's exercise, which is the pelvic floor strengthening exercise that
Yes.
patients can do. That works really well. And then they can also use, like we have in Ayurveda, we use the oil sitz bath. So you can have herbal decoctions as sitz bath where they can soak themselves and get the benefit of that. So that works really well along with internal medicine.
Thanks, ma'am. Thanks for sharing your secret of practices. Now, I would like to call Dr. Deepak Apar for vote of thanks. Thank you.
Hello, ma'am. Thank you, Dr. Vipul. Myself, Dr. Deepak Apar, Assistant Professor, Shalya Tantra Department.
We can't hear you.
Hello. Am I audible?
Yes, I can hear now.
Sorry for interruption. Myself, Dr. Deepak Apar, Assistant Professor, Shalya Tantra Department, Yashwantrao Chavan, Ayurvedic Medical College. Honorable dignitaries, distinguished guests, respected Chairman Sir, dear participants, on the behalf of Shiva Trust, Yashwantrao Chavan, Ayurvedic Medical College, its entire fraternity and organizing committee, I feel immense pleasure to take this opportunity to propose a vote of thanks to our eminent speaker, Dr. Ashish Paul ma'am, who is director of Ashishveda Hospital, London, who spared the time from her busy schedule for this webinar on national natural fertility and its scope in the management of fertility issues. I would further extend hearty thanks to Dr. Balasaheb Pawar sir, chairman of our trust, Shiva Trust, Aurangabad. I take this opportunity to specially express my deep regards and gratitude to Dr. Bhairav Kulkarni sir, principal of Yashwantrao Chavan Ayurvedic Medical College, Aurangabad. I would specially thanks to Dr. Pankaj Gahunge sir, vice principal of Yashwantrao Chavan Ayurvedic Medical College, Aurangabad. My deep sense and appreciations to thanks to all the participants who have participated and attended this webinar to make this successful event. My sincere attitude also goes to the organizing committee or coordinator for such a wonderful webinar. Last but surely not the least, I would like to thank media partner Indian Vaidyas for such a webcast for our webinar through the YouTube and Facebook handle. Once again, I would like to thank you all for being with us for this afternoon. Have a wonderful day ahead. Thank you, ma'am.
Thank you.
Yeah, Dr. Ashish, we have this certificate for you as well, Dr. Bhairav, if you are able to listen, so maybe. So thank you so much for being a speaker to this event today. And Dr. Bhairav, you are there? I think he's having some connectivity issues. So thank you so much again. And this is just a small token of thanks to you. And we also thank all the participants, all the doctors. And there are so many questions right now also pouring in. So I request all of you to maybe send your questions to the email. It was mentioned in the creative. You can check our Facebook page. We have shared there. And quickly, if anyone from the YCAM college can share the email ID so that we can have in the comment section, or what I can do is let me share our email ID. So you can just mention that this is of Dr. Ashish Paul seminar webinar. So we have just shared our email ID. So you can email us all the queries. We will forward to Dr. Ashish Paul and she will be able to answer you and give you the clarification as maximum as possible. So thank you so much again to all of you for this wonderful. I can see so many of you have attended this. We got more than 1,000 registration, and today also I think several thousand people have attended this. There are so many on YouTube, Facebook, and other.
Excuse me, sir. Sorry to interrupt you.
Yes, yes.
Kulkarni sir are there, please. Over to you.
Okay, Dr. Bhairav, I think he is not able to connect in terms of audio. So anyways, thank you so much again. And okay, so we have received the email also. Just a second, I'm just posting and fetching the email of ycamcollege@gmail.com. So you can send your queries and you can send your feedback. You can let us know on our social media page as well. And meanwhile, you can send your queries to the this email ID also.
Okay, thank you.
Yes, sir. Yes, sir. How are you? So we have just shared this certificate. So I just thought to maybe have your words on this.
Yes. Thank you, Dr. Ashish Paul, ma'am. This is presentation from our side. One of the certificate we designed for you, and keep your support to our college, our students, and all our staff also. And thank you, Mr. Piyush Juneja sir, who is our media partner today. And without his support, it never happened. So I thankful Dr. Piyush sir over here. And questions are still going on. So participant, may I request you, you can email ycmcollege@gmail.com is our email ID. Also, also you just email to Indian Vaidya also, and Dr. Ashish Paul madam will reply us soon to our queries. Thank you, ma'am.
Thank you.
Thank you.
Thank you so
Namaste.
much. Just last few words I want to say. You're doing great work. Keep doing it. Keep spreading Ayurveda. There is a need for it. Thank you.
Thanks.
Thank you. Thank you, ma'am. Thank you.
Thank you. Bye. Bye.